We are being bombarded with slogans. Stay home, save lives. Stay home, it could save lives. And stay safe. Stay safe. At the end of every conversation, someone will wish you to stay safe. We are being told that we have to flatten the curve. So there are two kinds of slogans over here. There's very simplistic slogans, simplistic messages. Stay home. It's like an order. Be quarantined. Accept isolation. Why? Because it could save lives. It does save lives. It could save lives. And along with that, we have the sciencey sounding slogans. Flatten the curve. Flatten the curve is some kind of statistics talk. And we're shown a graph that seems legit, seems scientific. And it's this combination of simplistic instructions along with something that sounds authoritative, seems scientific on the face of it, that is being used as a tool of mind control against us. And people comply. People swallow it up. They accept the argument from authority that the government knows best. These measures are in our best interest, and we can rely on them. But this is so foolish. It is so ignorant. Wake up. The government doesn't care about our health. It never did, at least not in modern times. They allow pesticides in our food. They allow, and in fact, specifically put fluoride, which is a toxin, a neurotoxin, into our water. They put carcinogens into vaccines. It says in the insert to vaccines that they have not been safety tested for being carcinogenic. There are endocrine disruptors in children's toys. They're right now rolling out a 5G system infrastructure throughout the world, which has never been safety tested, and it uses millimeter wave technology, which is known to be a military weapon. The frequency of this technology, of these radio frequency, is close to that of a sophisticated weapon. So they're rolling out this really nefarious technology, along with, of course, other things that are more about surveillance, like facial recognition technology. And of course, 5G itself is all about surveillance, in addition to the harm from the radiation. All this without consulting with the citizens. And then we have, of course, the chemtrails planes spraying us with heavy metals like barium and strontium and titanium and cadmium and aluminum. And yeah, they call it geoengineering with aerosols to fight climate change. But it's all toxic to our health. So what a joke to think that the government could care less about our health. They clearly want us sick. They want us weakened. And we're weak, we're less likely to rise up. They lower our IQ through the toxins in the water, and they weaken us and make us dependent on the state and dependent on Big Pharma, which is in bed with the state. We know that all these slogans, stay home, stay safe, stay home, save lives, These are all based on complete pseudoscience, completely debunked models, projections that were in the first place wildly speculative, but were accepted by the people because they blindly believed that since they have authority, this is a professor says so, well, it must be legit. But it was never legitimate. And we, the people, should have been much more skeptical of what we're told in the name of authority when the stakes are so high. We cannot trust a government. We cannot trust public health officials. We cannot trust anyone who has any conflict of interest and any, whether financial conflict of interest or some way that he can gain power or expand his power. And whenever there's a crisis, that's an opportunity for the government to expand its power. Never let a good crisis go to waste is the mantra of an experienced politician. We know what a lie COVID-19 has been, or at least the claim, perhaps there's a virus, but the claim that it's a pandemic, the claim that it's a major health risk, that is a hoax. That's based on statistics that have been artificially inflated through deceptive coding, through classifying people who died with COVID-19 as having died as a result of COVID-19, as classifying people who were not tested for COVID-19 but are assumed to have COVID-19, along with people with cases of people who did test positive for COVID-19. And for that matter, of relying on tests that are entirely faulty and don't even test for COVID-19, but only for coronavirus in general. The PCR test only tests for genetic material that is similar to corona, that shows coronavirus in general. And in fact, the inventor of the PCR test said that it should never be used as a diagnostic test. We know, worst of all, really, that this claim of tremendous danger from this virus is based on inflating the death toll through outright murder in the hospitals. For example, by default, putting everyone on respirators, ventilators, which are have a very high rate of death from them and should only be used as an absolute last resort. Well, they're used as a first measure in the hospitals. Why? Because they're getting money, many thousands of dollars for every single patient they put on a respirator and for every single patient they're able to diagnose as COVID-19. So therefore, we're hearing reports that I've publicized how the hospitals are by default treating anyone who they can possibly think might be COVID-19 as assumed to be COVID-19, and they're by default putting people on ventilators, even though the normal standard of care is to go from the least invasive treatment to the most invasive treatment. The most invasive treatment in this case is the ventilator, and that's actually causing the deaths. That's what we're hearing, in particular from Dr. Cameron Kyle Seidel. So they're killing people intentionally, systemically, in order to raise the death rates. But if you take out all those lies, all the fake, twisted statistics. And in fact, even if you count all those statistics with the official narrative of the statistics, you'll still come to the conclusion, and as has been publicized in recent days, that COVID-19 is no more severe than the seasonal flu in its lethality. And therefore, now that we know this, now this has all come out, for anyone who has eyes to see, for anyone who is in a complete blind sheeple, we're on to you. We know you're lying to us. This is a mind control operation. Clearly, governments worldwide are all in on it. It's a worldwide conspiracy. That's possible. Don't think that's not possible. It's completely possible. Governments all over the world coordinate. Intelligence agencies coordinate. They can coordinate something that will expand the power of all their governments. That's something that governments want. They want to expand their power. And the way they do so in modern times is through deception, a false flag operation, a hoax, an imaginary enemy, a staged event. That's the way to expand government power in modern times. There is an agenda of control over here. They're trying to control us. They're trying to manipulate our minds. We have to resist that. We can't give in to these slogans. We can't go along with them. Even if you're in polite company, don't go along with the slogan. Someone says, stay safe. Well, really what they mean is that they hope you don't get the virus, and you should know that you should stay indoors as much as possible because there's a plague going on. Well, you can politely respond and say, well, I want to stay safe, but not quite in the way you might think. You see, I don't want to participate with this propaganda. I don't consent. These psychopaths, they want to control my mind. They want to manipulate me. They want to essentially destroy our freedoms, our society as we know it, and remake it into a totalitarian society. I don't want that. And you shouldn't want it either. So, yes, stay safe. But stay safe from what? Not from this hoax. Stay safe from mind control. Stay safe from government public health experts who are paid to tell you what is not in your interest, what is in the interest of government power, what is in the interest of big pharma, what is in the interest of the elites who are pulling the strings behind the scene and paying these officials tremendous amounts of money to participate in this mind control operation. So I say, don't stay safe. Stay free. Stay awake. Don't stay home. Leave the home. Get out of the house as much as you can. If they're telling you not to be at home, then do the opposite. Not because you're like being infantile, but because you need to escape from this mental prison they want to put us in. Don't be a sheep. And especially this whole propaganda of social distancing, that's all nonsense. Break free of that nonsense. Social distancing. It's just a slogan to play with your mind. It's not true. Certainly hasn't been proven that social distancing is effective. And it anyway hasn't been proven and was never proven that this virus is so very lethal, so much more than the yearly flu. And so therefore just don't cooperate. Now, if someone else is not, you don't want to be rude if someone else thinks that if you walk near them, you're going to kill them. Well, I don't think that's true. But what I would say is any scenario in which you can see that someone else is also not buying the narrative. The problem is that there's still this taboo about it. Right? So I know that social distancing is nonsense. You know it's nonsense, but there's still a taboo because the propaganda is so pervasive. So in that case, at least, break through that taboo. Reach out your hand and shake his hand. Give him a hug if that's appropriate in that context. Don't, don't go along with this evil agenda, and make that clear to him and encourage other people. Say, this is an evil agenda to control us. Don't go along with it. Stay safe from all these methods of control. Stay safe from masks, face masks, to suffocate us. Stay safe from, in a way, from people who are brainwashed, who view anyone who will walk near anyone else as endangering their lives, which is not even the official story. The official reason for the measures is so that the hospitals won't be overwhelmed. Well, if you walk near someone else, you won't overwhelm the hospitals. It's just that, according to them, if many people will not obey social distancing, then that will have the aggregate effect of leading to a massive rise in the infections, which, according to them, will lead to a massive rise in death. Or so they say. It might happen and could happen, and so on, without any proof. But this is all nonsense. So yeah, stay safe from the deep state mind control. Stay safe from the groupthink and from people. I'm not saying not to associate with people who have succumbed to this groupthink, but be careful to register your disagreement. I mean, if that's possible in the circumstances, it may not be, but if you're able to register, make it clear that you don't agree with the government propaganda. Certainly stay safe from hospitals. Absolutely. In this time, do not go near a hospital. Find some other way to get treated. Maybe approach a private doctor. I don't know. The last place you want to go to is a hospital. Consider whatever other alternatives you could possibly find. God should save us from these psychopaths. And really, we need a miracle. So God should provide that to us to fix this absolute disastrous situation. God bless, and thanks for listening.